I'm a physician and a social entrepreneur, and I strongly feel and believe that health is a fundamental universal right for all. In fact, it's one of the key pillars of social development, along with education, fair income, and social protection. All four are inextricably linked, and without any of them, individual and social well-being is not sustainable. And in emerging regions, such as the developing countries in Latin America, it turns out that women play a key role in health because they're the central determinants of their children's, families, and communities' well-being. And this is first because traditionally they have been and they continue to be the primary caregivers for them in a matriarchal society, but also because women experience and report illness and tend to seek care and interact with the healthcare system more frequently than men do. And it's crucial that we understand that girls' and women's access to health care and their health outcomes is directly dependent on their education and income level, because well-informed individuals and people who are financially stable are better able to make the right kind of healthy decisions and to sustain and maintain them over time for themselves and their dependents. When a woman is healthy, she has an opportunity to access education, employment, and social empowerment. And in turn, a woman's good health and schooling and income has a direct positive impact on her families and community. So this is really a way to think about the situation as a win-win-win full circle. In Latin America, 125 million people have poor or no access to quality health care. In particular, women who are actually experiencing a disproportionately high burden of disease that is multifaceted. On one hand, the classic and some new reproductive and infectious disease issues, but also now the women there are facing the rise of the chronic disease epidemic as they live longer and they're adopting modern lifestyles that are often unhealthy. For instance, cardiovascular disease, and I'm talking about heart disease, stroke, hypertension, is now the number one cause of mortality and morbidity in Latin American women ages 15 through 44 at the peak of their productive lives, and also age over 60. Also, there is the big issue of cancer, which affects women earlier in life, especially breast and cervical cancer, but also cancers like breast and lung, which are actually still increasing for women in Latin America. Add to this the increased incidence of Alzheimer's disease, neurodegenerative diseases, mental illness, and the fact that due to their specific legal condition and situations, many women in Latin America are highly vulnerable to disease risk factors such as diabetes, obesity, or physical inactivity. So why is there a female-specific burden of disease in Latin America? Well, first there is the issue of biology and genes, and this is really the same throughout the world. And that is that many diseases are more frequent and severe in women than men. But also in Latin America, women are facing deep disparities in eco-social health determinants, some of which we have discussed, education, income, employment, but also others, for instance, behavior, the way in which society expects them to be the primary caregivers for their families, or the way in which fear and stigma affects women suffering an illness, but also other factors such as geographical location, rural versus urban. And another issue is that traditionally in Latin America, health systems have been gender biased. In the case of women's health, mostly focused on their reproductive issues, but also class biased and racialized. And in fact, poor, low income, uneducated women and women that tend to live in rural areas, so those who belong to indigenous or African descent groups, are more vulnerable to disease risk factors and have worse access to healthcare and worse health outcomes. And to all of these, add one more thing, and that is that on top of being the primary caregivers, women are the primary breadwinners in up to 20% of households in Latin America. And having this kind of heavy responsibilities, taking care of their families and also being the income earners, really takes away from making their health a priority and taking care of it as they should. So if we want to solve these issues and improve women's health, what can we do? First thing is that we need to be incredibly realistic. Right now, it's not in our hands to fix and change genes. It will be in the future, but not right now. But it really is in our power as individuals and as society to transform and improve the disparities in eco-social health determinants. So what should we do? First, transform our healthcare system from a reactive illness-fighting model to one that is highly proactive, in which we promote healthy lifestyles, prevent disease by diagnosing and treating early, and make the system participatory to women, making available to them the resources and education that are going to allow them to take care of themselves at the right time. The second thing to do is to make sure the system is sustainable. And by this I mean we need to increase the native trained care capacity of a country so that it can perpetuate and continue over time. We also need to make sure that our interventions are adaptive and adapted to the real life needs and the culture in which women live. We need to establish strong public-private partnerships and also eco-social health policies at the local and national level so that women have the resources and the policies behind them that are going to support their development and the opportunity to take care of themselves and their immediate circle. And finally, we need to make sure that our actions and systems are highly integrative and integrated through what I call eco-techno-social fusion. And by this I mean integrating our current medical and research knowledge and resources with the powerful mobile, smart and digital technologies that are arising that allow us now to deliver a real-time and precise care more universally, along with social innovation initiatives to improve the education and income power of women, to allow them to reach the healthiest possible lifestyle, but also to go beyond and transcend the geographic, temporal and social barriers which have prevented them from becoming equal partners in society and strong development engines in the world around them. Thank you.